We are working with a critical access hospital in the Southeast on a transitional leader project. And we have been there about 5 months. We're tracking close to a positive financial impact of nearly 1.5 million. There was some CNO turnover. In addition, they had lost a couple of providers. So as you can imagine, this kind of really cut into their admissions and such and their volumes. And that affects the bottom line for sure. One of the key things that I heard from the CEO in one of our conversations was that he really didn't want to keep running in place. And he was really ready to go to the next step and not really settle for where they were at. We were able to really source a very strong leader at the CNO level, one that I've worked with many, many times. A couple of our top and smart deliverables for the client were to focus on their swing bed program and secondarily to also look at their admissions in total for med-surg ICU. This was hitting their bottom line and that was really important to them. But really before we could get there in total for them, there were a lot of other things that we needed to look at and really build that foundation for them. One of them being leadership. Secondly, we looked at competency of staff because if we were going to grow the swing bed program, we wanted to make sure that the staff had the skill set they needed to care for complex patients. And then lastly, I think the staffing model really wasn't allowing nurses to practice really at the top of their scope. And they weren't really used to taking more than one patient or so. So we did a lot of work with the staffing model there. The swing bed program, I will tell you that we started there and the baseline for admissions there was like 5.5. We were able to increase that times 4. So we actually had the highest month of swing bed admissions in February, which was 21. Also, we looked at swing bed days and we have increased their swing bed days about 3 times. Really, I attribute that to the competency of the staff, and it allowed them to admit higher complex patients and felt confident that the staff could care for them. The leadership in total at the manager level, pretty novice leaders, but at the end of the day, I think that they haven't been led by the right leader. And they have certainly taken to our transitional leader and they're just blossoming. And it's pretty palpable and noticeable. I've been there a few times already, and the difference from when I first met these people to now is incredible. And I do credit that to our transitional leader who is there day in and day out mentoring the staff in total. With the swing bed program and the inpatient admissions in total, we're probably tracking about 1.5 million in total right now that we've realized for them, which is a big number for them, and they're just absolutely thrilled with the work that's being done there.